Welcome to A Fitter You Training Systems. I'm your main man, Dan the Man, and I'm the head trainer here at A Fitter You. And if you've been tuning in, you'll notice we've done a couple squat therapy videos. We've done 1 and 2, and both focusing on different avenues on how to help your squat, mobility-based and dynamic warm-up based. We're going to finish the series with an active way to kind of release that tissue, all the tightness that you get from all the different movements that the day-to-day activities bring, from sitting to standing to actually squatting in your workouts. So some of these movements we're going to be doing today, some of these techniques are really going to help with loosening up that tissue and allowing it to access its normal range of motion. All right? So with me today, you're going to need a couple tools. All right? I have a lacrosse ball here. Works great, but there's not a lot of give with this bad boy. Right? There's things called yoga balls, same size, but a little more pliable, a little more give. They kind of work with your skin to kind of mold and move. Those are excellent. You can use a golf ball. You can start with a tennis ball as well. A little more forgiving, a little more welcoming if you're just starting out with this. This is very isolated, very fine. So you're focusing on soft tissue here. All right? What we're going to be doing is we're going to talk a little bit about what happens when we squat. When we're in our squat position, our knees are tracking out, forcing out. That's engaging our abductors as well as our adductors on the inner thigh. What happens is a lot of tension, a lot of tightness starts to come through this area right here. All right? How to release that, how to work on that is greatly dependent on what you're doing. So what we're going to focus on today is releasing some of the tissue right around here and on the sides here. When you're doing any type of tissue release, any type of active release, you always want to focus on the muscle tissue, never the joint. You don't need to be on bone for this, all right? And you'll know the difference, trust me, in terms of pain, all right? This should be a hurts so good feeling, not a excruciating, agonizingly painful kind of thing, all right? So, first things first, taking the ball, I'm going to position it just above my hip and just above where my glute starts to end, right at the top of my pelvis, really. You have 3 large glute muscles. You have your gluteus maximus, medius, and minimus. We're going to focus on the outer edge, the upper part of your maximus, right? Our prime hip extensor, one of the largest muscles in the human body. So we're going to sit back, all right? I'm going to have the ball right there. Whoa, don't run away. I'm going to position it exactly where I said. So just above the hip and just above right kind of where the pelvis starts, the anterior posterior crest of that pelvis. And I'm going to position my weight. Anytime I'm doing any foam rolling, any active release, myofascial release, I'm not rolling out pizza dough, alright? Plain and simple. I'm not going back and forth, la-di-da. I'm focusing on searching for trigger points. If I found an area that's relatively tight, a little bit more sensitive, I'm going to hold some pressure on there and I'm going to breathe. Now, depending upon how you're set up, I have my arm anchored here, my foot anchored here. I can raise my body weight by pressing through these anchor points if it's a little bit too much, all right? But what you're doing is you're applying an active pressure to allow that knot, to allow that tension to release, all right? Now, if you're getting a little more advanced, you can take that hip through its range of motion. So I position this down, nice and easy, all right? I can have my foot here, or I can change positions. And what I'm going to do is I'm going to actively bend and straighten. So I'm taking my knee through flexion and extension, activating the musculature that you would normally see when you're squatting. So when you're flexion and extending in your squat rather, you're going to see that tissue activate the same way. And it's going to get tight, it's going to get stiff. So this is allowing it to kind of activate and release. Good. So what happens when our tissue is tight? We've just done a little drill to mobilize, right? What happens is our tissue should normally be able to flex and expand very nicely, very smoothly, in a perfect world. That's not always the case though. So what we have to see, or what we tend to see in very tight athletes, right, is kind of a nodding effect. The tissue starts to clump and it doesn't start to breathe the way it should, expand the way it should. It gets stuck and little knots and tight areas start to happen. If you want to do a feeling test, all right, tangible test, picture a steak or a chicken breast, all right? Anything that's rare, that's pretty good. You can stick your thumb in there, you got some nice loose tissue. Anything that's well done, a little bit more stiff, you know you got some work to do on this, all right? So your tissue can be brought back to a pliable, to a natural, to a full range of motion state, but it takes time, it takes patience, it takes a lot of practice. Soft tissue itself doesn't begin to change for around 2 minutes minimum. So when you're holding these, you want to work each side, really dig in there, set the clock for 5 minutes and go. Really get into those hips, and you will see such a better range of motion, such a more relaxed, more open feeling in your squats, because you're not restricted by that tight tissue. You'll be able to drive those knees out a lot more because the adductors and all the innervating tissue that runs up through here, your IT band, tensor fasciae lata, all of that will be a lot more loose and a lot more better for it. If you're tight through here, chances are along the side of the leg as well, translating down, you're going to be tight there as well. So focus, take your time going it up bit by bit. This is one leg, do not forget to do the other leg. Just because you're tight and loose on one side, make sure you're both always maintaining that balance throughout the body. Alright? Last but not least for our squat, I'm going to spend some time on these guys right here. The feet. Alright? So often we focus on all the muscles throughout the body, but we forget our arches and how important maintaining that natural range of motion, that natural pliability through the arches is. So what we're going to focus on here is using my lacrosse ball again. Something a little more rigid, a little more stiff, maybe a little bit better, but it's all going to be dependent on how your body feels and where you're at with this. Alright? What I'm going to do is I'm going to apply direct pressure through my arches. I have 3 major arches through my feet. I have my lateral, medial, longitudinal arches that run up through the width of the foot. And I have my transverse arch, which, as speaking transverse, runs horizontally. We have to take care of all those. So I'm not just going back and forth, once again rolling out my pizza dough. No. You're focusing on really activating, really getting at that tissue. If you know which direction that tissue runs, that's where you should be doing it. So I'm going to apply pressure. You can either do this standing or sitting. Sitting is going to be a nicer little modification. And I'm going to search just in between the midfoot. Ooh, run away again. Just in between the midfoot from heel to about where the ball of your foot starts. And I'm going to search there. And I'm going to hold once I find a spot, and I'm going to kind of try to grab the ground with my foot and then expand. Grab the ground with my foot and expand. And I might move it up a little bit, right in between the balls of my foot, and the same thing, grab and expand. Grab and expand. I might do 10 pulses per arch, per side if you'd like, or you can set a clock for 2 minutes and just hit different areas where you're tight. If you spend a lot of time on your feet, if you do a lot of endurance activities, this is something that's going to pay huge dividends in the end, man. It's the little things and how you take care of your body, alright? So, one foot, other foot. We've talked about the hips, taking care of our adductors and abductors, focusing on the arches. All those things lead to our squat. Healthy feet, healthy squatting, man. That is it with a Fitter You. Thank you again for tuning in to the final squat therapy series. We're looking forward to many future videos and any of your comments. Please give us a like on Facebook. And as always, peace.